Okay, some other drugs. So these are all the drugs we're going to talk about, and that's it. And then we're done with this. Fluoroquinolones is the only class in this list. The rest are individual antibiotics. Okay, so the fluoroquinolones includes antibiotics that you have heard of frequently. Ciprofloxacin or Cipro, right? Levofloxacin, which is Levaquin, very, very common. What's that? Did I butcher that name? Yeah, it's ridiculous. They're all ridiculous. They're like my 4-year-old came up with this. We'll just call it Ciprofloxacin. That's exactly what it sounds like. So yeah, the fluoroquinolones is a class that includes several Metronidazole, right? Otherwise known as Flagyl. I'm sure you've seen that a lot. Metronidazole is an individual antimicrobial. Daptomycin, which we'll talk about. Rifampin, rifaximin, in addition to being used for a variety of infections, are also part of the regimen to treat tuberculosis. And then bacitracin and polymyxin are actually topical antibacterials. Okay? They're not taken, they're not ingested. Okay? So we're going to talk about, these are the last drugs we're going to talk about. So fluoroquinolones. Broad-spectrum agent with multiple applications. They disrupt DNA replication and cell division. They can all be administered both orally and intravenously. They're very powerful antibiotics. Side effects generally are mild, but it can cause tendon rupture. Low risk of this, but it's a little like, these are generally very safe drugs, except for when they kill you. It's like a very weird statement. But the fluoroquinolones can damage connective tissue, which can get into these tendons and really break up that connective tissue. And it usually, when it happens, it usually affects the Achilles tendon, right? That's that big tendon that your heel is attached to. And so we tend to avoid it in patients younger than 18 years old. There is a risk to all patients, especially those older than 60. Those who are taking glucocorticoids, right? The risk of tendon rupture is greater in those older than 60, those taking glucocorticoids, those who have undergone kidney, heart, or lung transplant. Okay? So you would try to avoid it, but you may be put in the position where that's the only antibiotic that you can give them. Okay. Yes, exactly. So ciprofloxacin is the prototypic fluoroquinolone. It's a broad-spectrum antibiotic. It's effective against gram-negative and some gram-positive organisms. The fact that these fluoroquinolones have a high activity against gram-negatives is why sometimes we're forced to use them in patients where it may not be our ideal choice. It inhibits bacterial DNA replication. It blocks an enzyme called gyrase, topoisomerase. It's used to treat infections in multiple systems. So we tend to think about ciprofloxacin in relation to anthrax, right? So it is the drug of choice for anthrax infection. And there was, I don't know how many people are old enough to remember this, but post 9/11, right? Yeah, like in the year or two after 9/11, there I don't know. You guys all look too young to remember any of these things, but you don't remember. See, thank you. Yeah. So yeah, in the like aftermath of 9/11, there was actually this emergency of anthrax being sent through the mail, and it was being sent to Congress people and other people in political office, and there were people who died from it, and it was a real issue. And so during that time, there was this demand for ciprofloxacin, and there was a total shortage of it because the demand was so high. I had a student 2 years ago who worked in the post office at that time, and she said that they were terrified. Everybody in the post office was absolutely terrified, and there was a point during the crisis where they were told that there just isn't enough Cipro, right? And so there were days where they just sent everybody home because the fear was too high and there just wasn't enough antibiotic to handle treatment in the case of contracting anthrax. So, yeah. Is that why from then on, that they have to wear gloves now? Makes sense. That would make sense. Everything you touch, people have licked, right? So I would probably want to wear gloves anyway. This is DNA covering everything. So ciprofloxacin is effective against lots of respiratory infections, urinary tract infections, GI, bone, joints, skin, and soft tissue. Infections of these kinds of tissue are actually quite difficult to treat. So infections of things like bones and joints is very difficult because they don't actually get a high degree of perfusion. And then these antibiotics are often polar chemicals. And so the penetration, particularly into bone, is very, very difficult. So bone infections can become very problematic. You don't want infections to spread to bone because it's very difficult to treat. Intraosseous, they're really getting into the bone marrow, right? But if you've got an infection that's in that bone matrix, it's very difficult to treat that. Yeah. I'm not sure if they would give intraosseous injections for bone infections. It's a good question. Yeah. So adverse effects, there are some mild adverse effects, things like GI upset. We have CNS effects, dizziness, headache, restlessness, confusion can occur, and very rarely seizure. We have that tendon rupture, which we know there are some individuals who are more sensitive to it. Phototoxicity, so very sensitive to sunlight. Candida infections, so yeast infections. Yeast infections of the mouth and throat that we refer to as thrush, vaginal yeast infections, and also male genital yeast infections, which can be very scary for men because it looks terrible. It's a terrifying appearance for the owner of that genitalia. But it can happen. So it's like if you've got patients who are taking Levaquin, Cipro, whatever, that is definitely something that can happen. Increased risk of C. diff. Okay, so that's another thing we worry about. With older adults, the CNS problems can be a little bit more acute. So confusion, somnolence, meaning very sleepy, difficult to wake. Are you guys still on the male genitalia? Come on. All right. So confusion, somnolence, psychosis, visual disturbances, okay? And then in older patients with myasthenia gravis, it can also be problematic. Okay. So drug and food interaction, absorption of ciprofloxacin is reduced by aluminum antacids, magnesium antacids, iron salts, zinc salts, sucralfate, milk and dairy products. Okay, so this sounds very similar to what we saw with the tetracyclines, right? So it's a similar problem. We also see elevated drug levels when you take ciprofloxacin and the following drugs. These drugs underneath will have elevated levels. Okay, so elevated levels of theophylline, warfarin, tinazole, right, which is an antifungal. Okay. So being careful if you're combining those drugs. And so the fluoroquinolones, we have ofloxacin, moxifloxacin, norfloxacin, levofloxacin, and gemifloxacin. Okay. Not all of those are on your drug list, right? Most of them are. But basically all of the floxins, right? And they're all very similar. There isn't really a notable difference for our purposes among them. Okay. Metronidazole, otherwise known as Flagyl. It is a bactericidal antibiotic. It can be used. Metronidazole is a very useful drug because in addition to being antibacterial, it can also kill protozoan infections. So like yeast infections yeast are protozoa. So infections by obligate anaerobes, which are very difficult to treat. Okay? H. pylori, it can be effective for H. pylori, and it's also usually a first-line treatment for C. diff. Okay? CDI is colostrum difficile infection. So C. diff infection, metronidazole tends to be our first-line drug. Adverse effects, neurotoxicity. Okay? So it can negatively affect brain function, allergy, and superinfections. Okay. Affecting neuronal function. So it can injure nerve cells of both the peripheral and central nervous system. Yeah. Daptomycin, another mycin, right? It's not a macrolide. It doesn't belong to any of the other mycin families. It is what we call a cyclic lipopeptide. It's a brand new class. Kills virtually all gram-positive bacteria, including MRSA. Right? It can be used, it's frequently used for bloodstream infections with Staph aureus, complicated skin and skin structure infections caused by susceptible strains of gram-positive bacteria. So cellulitis, right? So gram-positive bacteria, most of these skin infections are going to be staph infections, staph A. And so if they're really difficult to treat, they're not really responding to other treatment, daptomycin has become a second-line drug for that. no significant drug interactions. Adverse effects is possibly some muscle injury. Okay? It's also fairly new, so we don't know as much about it. We're going to discover more. As it's used in more and more people, we're going to discover more interactions and adverse effects. It's given once a day, daily IV, with no laboratory work needed. And we don't monitor peak and trough or any of that. Yeah, yeah, that's a good example, right? So very persistent infections that are difficult to get rid of, yeah. Yes? So the first choice drugs, the penicillin, cephalosporin, yeah, like those drugs are very good against those gram-positive bacteria. Yeah. But if it's not responding to all of those, or you have a patient who's allergic to it, or then daptomycin can be brought on board. So rifampin and rifaximin, these are broad. So rifampin is a broad-spectrum antibacterial used primarily for tuberculosis, but it's also used for some forms of meningitis. Okay? It's not usually used alone. It's usually combined with other drugs. With tuberculosis, patients are on a pretty large cocktail of drugs, okay? And rifampin is just one of them. It can also be used as a prophylaxis for meningitis with Haemophilus influenzae. So if you have a breakout of meningitis, right, in a dormitory or a long-term care facility or something like that, you can treat individuals with rifampin as a prophylaxis, right? Rifaximin is a non-absorbable PO form of rifampin, and it's used primarily for traveler's diarrhea. Okay? So it's not absorbed into the bloodstream. It stays in the GI tract. Okay? And so if you go and make the mistake of eating street food or brushing your teeth with the local water or something else like that, and you've got traveler's diarrhea, this is one example of a drug that can treat that. The adverse effects of the drug are not all that different from traveler's diarrhea, shockingly. Nausea, flatulence, defecation, urgency. There is a newer indication for the drug, and that's using the drug in patients with chronic liver disease. So patients with chronic liver disease tend to have a real problem with infection, and particularly in these infection blooms in their GI tract. And what happens with these infection blooms, the bacterial count gets very high, and then that bacteria starts to produce lots of ammonia. Okay? And then the ammonia gets absorbed in the bloodstream, and since the liver can't detoxify that ammonia, they get what's called encephalopathy, which is an acute delirium associated with liver failure. Okay? So if that acute delirium, if that encephalopathy is thought to be caused by one of these bacterial blooms, right, in addition to bringing down the ammonia, using rifaximin can reduce that infection and improve the situation. So that's a newer indication for the use of this drug. And then lastly, the last two antibacterial drugs, bacitracin and polymyxin B. Bacitracin, these are topical antibacterials, and mostly because they are too toxic to be given systemically. Okay? They're highly toxic drugs, so we don't put them in our body, we just put them on the top, right, on the outside. So bacitracin is usually used topically for bacterial infections. It's that stuff that comes in those little packet ointments that I steal from the hospital all the time. If given systemically, can cause major serious toxicity. Polymyxin B is usually formulated in an eye drop and is used to treat both ears, eyes, and also skin. And it's polymyxin B is a common treatment for bacterial conjunctivitis, so pink eye. Right? And if you're a parent, you deal with at least 10 outbreaks a year of pink eye in your home. Everybody's got pink. Especially what? Yes, yes. I actually had to go to a meeting one day with just this one eye that was just like throbbing with pink eye. It's like, I have to go. I'm here. This is me. Super mom. But yeah, polymyxin B are those eye drops that are used for, it's in those eye drops used to treat pink eye. And again, not used for systemic infections because of the toxicity. Okay.